Hello, my friends. Welcome to my YouTube channel. My name is Dr. Sayed Kazmi, and I'm a pediatrician. And today I'm going to talk about the differential diagnosis of dysphagia. Dysphagia simply means difficulty in swallowing. And difficulty in swallowing can happen because of a variety of different reasons that can vary from mechanical obstructions in the gastrointestinal tract to neuromuscular conditions. Now, it can happen because of problems anywhere starting from the oropharynx, from where your swallowing process starts, down to the lower part of the esophagus, where is the lower esophageal sphincter and where the esophagus enters into the stomach. So the problems anywhere, whether these are mechanical problems caused by obstruction, mechanical obstruction, or whether these are caused by neurological conditions, they can cause dysphagia. Now, clinically, when we are evaluating any child with dysphagia, we usually look into the fact whether the dysphagia is for liquids, whether it is for solids, or whether it is for both. And the other thing is whether it is something which is a static condition, where the condition is static in the sense that it is neither improving nor deteriorating, or the other aspect of this thing could be a progressive dysphagia, where the dysphagia is gradually worsening over the period of time. Now, dysphagia, which is more for liquids but not for solids, let's say a child who complains that he cannot swallow liquids but he can easily swallow solids, that's usually caused by problems in the oropharynx. So if there is oropharyngeal incoordination, and that can happen because of many reasons. It could be because of neurological conditions or neuromuscular conditions, like problems with the 9th or 10th cranial nerves, and that can happen because of any problem in the brainstem, or it can happen because of some neuromuscular conditions like myasthenia gravis. So in that condition, if the oropharyngeal muscles are more involved, there will be more dysphagia for the liquids as compared to the solids. If it's the other thing that the dysphagia is more for solids as compared to the liquids, then it could be any problem, mechanical obstruction, right, starting from the upper esophagus down to the lower esophageal. So like mechanical problems like you can think of a growth, like an esophageal cancerous growth, that can cause more dysphagia for the solids rather than the liquids, because the liquids can simply trickle down but the solids would hit the mechanical obstruction, and obviously there will be more problem while swallowing. And it can also happen if they've got some foreign body which is lodged in the upper part of the digestive tract, like an esophagus. Somebody swallowed a coin, or somebody swallowed a big object which is stuck there in some of the sites which are known for their anatomical construction. So the child can have more dysphagia for solids as compared to the liquid. If there is dysphagia both for liquids and solids, same intensity, then usually this happens because of the problem at the lower end of the esophagus. So if there is obstruction at the lower end of the esophagus, which usually in children can happen if there is achalasia of the lower end of the esophagus, where there are no neurons, so there is a sort of a stricture and it doesn't relax. So what happens whenever they are taking any food or something, it just goes down and it just like is stuck at the lower end of the esophagus, solid or liquids, and it's very difficult to swallow. So usually that thing is caused by problems at the lower end of the esophagus. So how do we work up a case of esophageal like dysphagia? Usually after taking a history which can tell us whether there is something wrong at the upper end of the digestive tract or whether it is something at the lower end of the esophagus, we can order investigations. Usually video fluoroscopy is one thing which can be used for oropharyngeal incoordination, and usually barium swallows and endoscopies are used for problems down in the esophagus or down at the lower end of the esophagus. So for that we can do endoscopy, or we can do a barium swallow test, which can detect any pathologies lying in the this part of the esophagus. How do they present? As I told you earlier, dysphagia simply means difficulty in swallowing. But apart from difficulty in swallowing, if the problem is at the upper end of the digestive tract, at the oropharynx level, they can have problems with, like they can spit the food out. They can have choking. They can aspirate food particles, which can give them wheezy chest, which can give them recurrent pneumonias, and in the long term, it can lead to failure to gain weight as well. And this, if the pathology is at the lower end of the esophagus, that usually leads to obviously difficulty in swallowing, and can also lead to vomiting, which is usually 5 to 10 minutes after taking food. And in the long term, it can lead to failure to gain weight. How these conditions are treated depends on the underlying condition. Like if it is caused by myasthenia gravis or something, you have to treat the underlying condition. If it is caused by mechanical obstruction, obviously you have to surgically dilate or remove the obstruction. And if once the underlying pathological process is cured, the symptom itself would be cured. So this was this was in a nutshell the differential diagnosis of dysphagia in children and how do we approach it. Thank you for watching my channel. If you are watching my channel for the first time and you have liked this video, a subscribe would be fantastic. And if you have liked the video, share it with your friends and also comment. Thank you very much and have a good day.